80% of premature heart disease and stroke is preventable. So there's a huge opportunity there. There shouldn't be 10,000 people a year dying from heart disease and stroke when so much of it is preventable. And that's the really strong focus of the work to influence that change.
Welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Ezine. On this episode, we'll be talking about heart health, the causes of heart disease and stroke, who is most at risk, and what we can do to minimise the risk. I'm delighted to introduce Janis Morrissey, Director of Health Promotion, Information and Training at the Irish Heart Foundation, who will be discussing all of this as well as giving us an insight into the work of the Irish Heart Foundation. You're very welcome, Janis.
Thank you.
Janis, maybe just to start with, can you explain briefly what heart disease is and who it most affects?
Yes, so cardiovascular disease is like an umbrella term. So that covers heart disease and stroke and things like angina, heart attack, etc., but also diseases of the blood vessels too, and heart valve disease. So it's a really wide range of conditions that affect the heart and the blood circulation system. And I suppose in terms of who it affects, if I ask you to picture someone having a heart attack, you'll probably think of a middle-aged man clutching his chest, kind of like in a soap opera or a Hollywood movie. But in fact, 1 in 4 women will die of heart disease and stroke. And that's the same figure as for men in Ireland. So there's a real myth that women have breast cancer and men get heart attacks. And that's very much not the case. So women are 6 times more likely to die from heart disease and stroke than breast cancer. So it's very much a condition for all of us to be concerned about. And the other thing as well is that there's kind of social disparity. So those who live in less affluent communities are much more likely to be affected by heart disease and stroke and to die from those conditions as well.
Right. Okay. What are the common causes of heart disease and stroke?
So we're probably familiar with a lot of them. So we tend to divide them into things we can't change and things we can. So what we can't change, obviously, is getting older, our sex, our family history, our ethnicity. But the good news is that there's lots of things that we can change. So that's things like how active we are, our diet, whether we smoke or not, high blood pressure, high cholesterol, diabetes. But it's more complicated than that because, of course, we need to look at the causes of those causes as well. And that's something that we might talk about a little bit later on.
Yeah. Okay. And Janis, heart disease is one of the leading causes of morbidity and mortality in Ireland at the moment, isn't it?
Yes, sadly it accounts for almost 10,000 deaths a year in Ireland. And we know that there are over 600,000 people in Ireland living with the effects of heart disease and stroke. And every year we would see over 80,000 people discharged from hospitals back into their communities living with these life-changing conditions.
Okay. And we talked about the common causes of heart disease and stroke, but is there a strong awareness of the symptoms, do you think, of heart disease and stroke?
I think we've made great strides in terms of stroke symptom awareness with the FAST campaign that the Irish Heart Foundation has run for many years.
Yeah.
So people will be familiar with face, arm, speech and time to call, and that time is brain. As we say, the more quickly that emergency services attend a person, the more quickly that brain can be saved. So we've made great strides, as I say, there, but probably not the case with heart attack symptom awareness, and that's been recognised at a policy level that there needs to be more awareness there. So particularly with our Her Heart Matters Women's Heart Health Awareness campaign this year, we focused on symptom awareness so that women are aware of how heart attack might manifest itself in women. So we're familiar with symptoms like, clutching your chest or having pain down the left arm. And women do get those common symptoms that we might think of. But there are less common symptoms that women can have for heart attack as well. Things like jaw pain or severe fatigue. And they're more generic. I've spoken to a woman in recent months, her only symptom was jaw pain. So she went to her dentist, naturally, as you would. And in fact, she was having a heart attack. So that's been a really important part of our Heart Matters campaign, is to make women aware of these symptoms. But importantly, if you feel really unwell, please go and get checked. Call emergency services immediately. We've had women who have driven themselves to the hospital. I'm fine, I'm grand, I don't want to cause a fuss. And in fact, they've been having a heart attack. So it's a really important part of our heart attack awareness messaging.
Yeah. And I mean, just to switch to stroke for a second, my dad had a stroke about 10 years ago now. He didn't feel very well, but he went swimming that morning. He cycled home and then he collapsed. But actually, going back to your FAST campaign, my mum remembered that campaign and that line about the quicker you get the person in, the more the person you save. Thankfully, we got him in that window and he's doing great now. But it's so important that people realize and act on symptoms, isn't it?
It really is. And it's really the repeated campaigns year on year to cut through the noise. We're all bombarded with so many messages that it's really, when the campaigns are repeated, that's where it permeates into our consciousness a little bit more, that in those emergency situations, you can call to mind something as simple as FAST.
And where can people get more information about what we've talked about there in terms of symptoms?
So the Irish Heart Foundation website, irishheart.ie, has a wealth of information on heart disease and stroke in terms of the diagnosis and treatments, but also on prevention and healthy lifestyle messaging as well. And I should say also our nurse support line is available Monday to Friday, where we have cardiac nurses available to support you with any queries that you might have.
Okay. And just maybe to talk about the Irish Heart Foundation now for a little bit. I'm sure a lot of people, or most people, are familiar with the Irish Heart Foundation. You're a very well-known organisation, but could you tell our listeners a little bit more about the work that the Irish Heart Foundation is involved in?
Yes, so we are the National Stroke and Heart Charity, and we've been serving generations of families since 1966. So we do rely very heavily on the generosity of the public in terms of donations to support our work. Our mission is really to eliminate preventable death and disability from heart disease and stroke, but importantly also to care and support for those diagnosed with these conditions as well. And we do this through 3 pillars. So we call them defend, empower and care. So defend is our work in terms of advocacy and policy, so where we are calling for improvements in patient services, but also policy change around the factors that affect our health, like alcohol and air pollution and smoking, etc. Empower is our work to promote health information and tools to support people with healthy lifestyles, but also our CPR training as well for the public and health professionals. And then care is our patient support services for those who have had a stroke or a heart condition diagnosis.
Okay, very good. So it's very much focused on prevention.
Yes, so ever since our inception back in 1966, there's really been great foresight by those who founded the foundation to focus on prevention, recognising that 80% of premature heart disease and stroke is preventable. So there's a huge opportunity there. It doesn't have to be this way. There shouldn't be 10,000 people a year dying from heart disease and stroke when so much of it is preventable. And that's the really strong focus of the work in the foundation at a programme and at an advocacy level to influence that change.
Yeah, and I know also you work very closely with HSE colleagues as well.
We've had a long-standing, very positive partnership with the HSE. At a national level, we would collaborate on groups like the Healthy Weight for Children policy group, the out-of-hospital cardiac arrest strategy, stroke implementation group as well. But then importantly, at a local level, there's lots of activity in partnership with HSE colleagues. Many of our CPR training sites would be HSE sites. We run the Happy Heart Healthy Eating Award to support healthcare facilities to have heart healthy choices in staff restaurants and for visitors as well. And we also do lifestyle assessment checks for HSE staff supporting the Health and Wellbeing initiative. And importantly as well, many healthcare providers in the HSE refer into our services, and likewise we signpost to HSE service as well. So it's a very symbiotic relationship, I would say.
Yeah, very good. And maybe just turning to yourself for a moment, Janis, have you always worked in this space?
Pretty much, yes. I originally qualified as a dietitian and I joined the Irish Heart Foundation in that capacity and worked in that for many, many years. And then I've been fortunate to grow and develop into the role that I'm proud to be doing today, leading the health promotion and prevention services. Very happy to work in a national organisation that's very forward-looking and great team of not just staff, but volunteers as well. Very happy to be here.
Over the years, have you seen a change in approach from a prevention perspective?
Yes, there's been increasing recognition of the value and importance, not just in terms of individuals' quality of life, but also from an economic point of view, the cost-saving benefits to the health service and to wider society as well. I think there's an awful lot more to do to really get that on the political agenda. And I think, approaches around co-design with the public and with patients and really truly listening to people around what their needs are has been, incredibly invaluable. And that's added a real richness to the work of the Irish Heart Foundation, that we're not telling people what to do. We're listening to what they need. And oftentimes people know what they should be doing. The challenge is, that health behaviour change. And that's why we've really shifted to focus on developing tools like our self-care and wellbeing journal for women to support people in identifying their health goals and identifying barriers and making those small sustainable changes that actually will help to reduce their risk of heart disease and stroke.
Yeah. And it is about those small sustainable changes, isn't it? It's tweaks really to your lifestyle as well, isn't it?
It really is. We always say it's not about boiling the ocean. It's about identifying one change that you might like to feel that you could make. And if you don't feel ready to make changes, that's okay too. And I think that's important to, sometimes it's all about change and joining a gym and changing your diet radically. And that's just really not sustainable. So small sustainable changes, identifying one or two goals that you can make changes in your life and then gradually building on that over time. And, how important is that change to you? How confident do you feel in making that change? What might get in the way? There's a real focus in our tools and resources on supporting people on that journey.
Yeah, very good. Actually, it struck me, I spoke to Elaine Murtha not too long ago about physical activity. And I was asking her what's the best exercise, and she said the best exercise is the one that you do yourself and that you keep doing.
Absolutely. And it's the one you enjoy.
Yeah.
And that's so important. And that's true of food as well. Back to my dietetics background, food is about much more than nutrition. It's about what do you enjoy? And that's incredibly important.
Yeah. And Janis, does heart disease and stroke have symptoms?
Not necessarily. If we think of high blood pressure, that is the most common risk factor for heart disease and stroke. It actually is symptomless. It's very unusual to have symptoms, even though we've done research and people tend to think about things like migraines or having a red face or other symptoms. But in fact, it's quite unusual. And that's why over the last number of years, we've run the Before Damage is Done campaign, targeting people, particularly over 50s, who are not diagnosed with high blood pressure, and really highlighting that the only way to know if you have high blood pressure is to get it checked, either with your GP or with your local community pharmacy. And the good news is that once diagnosed, it's easily managed. So it's really about, knowing your numbers and going to get checked.
Okay. So it's important to go and get that regularly checked.
Yes. So we would say really anyone over 30 should have their blood pressure checked every 5 years. And obviously your GP might advise more frequently depending on other risk factors or your family history.
Yeah. Okay. And Janis, what type of activities do the Irish Heart Foundation undertake?
So our activities are divided into our pillars of defend, empower and care. And some examples of our defend work in terms of advocacy is the Stop Targeting Kids campaign. We've had a long history of lobbying on protecting children from junk food marketing, and particularly now the online environment as well, and with the establishment of Commission Yaman now as well. So there's a great opportunity to mobilise parents and young people as well directly to ensure that young people are adequately protected from the targeted junk food ad.
Okay. Could you talk to us a little bit more about the Stop Targeting Kids campaign?
So it's really been around protecting young people from the targeted marketing that happens behind parents' backs, really. Television ads or billboards, we all see the same thing. But in the digital environment, we've commissioned research over the years that has demonstrated that young people see radically different ads. And of course, now it's not just about ads, it's also about the influencer user-generated content as well, where high fat, salt, sugar foods are seen to be fun and engaging and exciting, and all of those attractive principles that really engage young people and really normalize these types of products. And then when they're exposed to the food environment, this marketing really comes into its own. And another dimension of our Defend pillar is our Patient Champions activity. So we have supported a number of patients to become advocates within their own community to lobby for improved heart and stroke services at a local and a national level. And anybody who's interested is welcome to visit our website, irishheart.ie, if they'd like to become part of that movement.
And Janis, could you tell us about Empower?
So our Empower work is to support the general public and also patients with health information and tools to lead healthy lifestyles. And that also includes our health awareness campaigns and our programs. So, for example, we have the High Risk Prevention Programme in partnership with the HSE, which is part of the Chronic Disease Management Programme, supporting individuals who've been identified with maybe high blood pressure or high cholesterol and supporting them on a health behaviour change journey to reduce the risk of actually going on to develop a heart attack or a stroke. We do an awful lot of work in schools as well, both at primary and post-primary level. And we do a lot of co-design work. We really place the voice of young people at the centre of the work that we do. So rather than just doing a survey or consulting, we actually take the time and the resources to actually listen to young people. What does health mean to them? Oftentimes health is not even on their radar, and we talk about maybe living your best life and other avenues to maybe understand their actual lived experience. And we use tools like vignettes, so stories, to kind of depersonalize talking about maybe subjects that might be quite stigmatizing, particularly in underserved communities as well. So that's really allowed us to get great insights with young people around what their actual needs are. And then we've gone on to develop teaching resources and classroom supports to help improve the health literacy of young people as well. And that's all part of a World Health Organization program that we've been part of for the last number of years.
Oh, very good. And would you like to tell us a little bit more about that health literacy program?
Sure. So this has really been because, there's increasing recognition of health literacy as being a determinant of health in its own right.
Yeah.
And it's really around how do people find, understand and use health information. And that's often been in the context of patients and understanding their diagnosis and their treatment. But in the Irish Heart Foundation, we've also extended that to children and young people as well, because it's really a life skill. We're all exposed to health information, even if we're not diagnosed with any particular condition. It's also featuring more now in the curriculum as well. So we have done a lot of grounded work, really kind of harnessing local wisdom in individual DEIS schools. We've gone in and done a needs assessment, understanding the environment, because DEIS schools are not homogenous. There's a huge variety there, and understanding the actual school community, understanding, the teachers, the students, the school staff and the wider community and context. And then from that, we've done workshops, both on-site and off-site as well with young people. And that's been kind of using co-design methodology and design thinking and World Cafe and arts and crafts materials. They've had a mandate, importantly, from school management to do this work. It's not just a consultation. This is about, how can young people improve the world that they live in? And there's a meaningful work and outcome there. So things like movement breaks in schools, increasing the opportunity to not just do PE, but, have movement throughout the school day, and also, redesigning the school canteen. It's been about life skills like time management, organizational skills that are fundamental to health as well. It's really come from the ground up, and there's been, such energy and engagement. And every time we work with young people, we always evaluate, how did that go? Did it make sense? Does it resonate? Is it true to your experience? And we've had amazing feedback from, young people. One example would be that I felt that my opinion counts. And that's so important, whether it's young people or whether it's patients, that people are truly being listened to and that they're part of the evolution of our services.
Yeah. Actually, I was going to ask you about the engagement from young people, whether they do engage and what the feedback has been like.
They do when you put the time and resources into it, and it's genuine. It does take time. You can't just, go into a classroom and do a workshop. It takes time to build the relationship and the credibility, and those vignette stories that I mentioned, are really important, because we listen to people and we develop those vignettes that Saoirse is 12 and she lives with her mum and she, they get takeaways every night and, that type of scenario. But then you go back and say, does this actually make sense to you? Does this sound like your friend or your cousin in your community? Does it resonate with you? And it's allowed us to talk about Saoirse and not talk about them as individuals. And it's really fostered very deep insights that has really been so meaningful in furthering our work with young people in this area. And
could you tell us about the care area, Janis?
So this is our patient support services. So being diagnosed with a heart condition, be it heart failure or having, survived a stroke, can be a really lonely and worrying time, especially when people are discharged back home to their families and to their communities. And they're coming to terms with this diagnosis. And that's where the Irish Heart Foundation comes in, providing that support for people to help them understand their diagnosis and their management, helping them to self-manage as well, understand medications, understand any future tests. But importantly as well, helping people to have counselling and find ways of living with these conditions into the future. And also meeting other people who've had similar experiences, be that online or in person. We've a range of supports for people. It could be something as simple as a newsletter, but we've got a whole Heart Connect and Stroke Connect service for people, and they can go through support with various health professionals. We have things like fatigue management and mindfulness, our choir. So there's a whole menu of options. People can dip in and out as they feel they need. So we're really there for people, not just when they're coming to terms with their diagnosis, but as they learn to live with their condition.
Yeah, because I would imagine it's a very lonely or scary time when you're coming to terms with that condition. So any support like that, I'm sure, is very welcome.
Absolutely. I mean, there's the whole acute period where you're in hospital and you have a battery of tests and you have a battery of health professionals supporting you. But it's that, okay, I'm back home now. This is my life.
Yeah.
And that's really, our role is really to support people in finding a way to adapt and come to terms and self-manage their condition.
Yeah. And where can people get information about those services? Is that on your website as well?
Yes, irishheart.ie has information about all of our services.
You mentioned policy earlier. We might just talk about that now for a little while. I read in the Irish Heart Foundation Summary of Primary Prevention of Cardiovascular Disease, which was published last year, just to read a piece or an extract from that, where you say there's a disproportionate focus on the need for individuals to make different choices and change their unhealthy lifestyle, as opposed to the need for system level change to support healthier choices. I just wanted to talk about that. It just struck me in terms of a narrative, those supports that you mentioned earlier about putting those in place as opposed to an individual responsibility on people.
Yes, indeed. So we're really all products of our environment. Information, awareness, education are incredibly important, but in of themselves are really not enough. People need support. They need to live in a supportive environment. And unfortunately, that's not the case in many circumstances. So if we think about the circumstances that we're born into, that we live in, that we age, that has a huge influence on our health. And as I mentioned earlier, the health disparities, if you live in an area that you don't have access to healthy food, to safe opportunities to be active, if you don't have opportunities for education, then that has a huge influence on your health over lifetimes. So prevention is about more than campaigns and early detection. It's really about looking at, what causes people to have poor health in the first instance. So there's really been an over-reliance on looking at individual responsibility. And, if only we had another education campaign, ills of society would be sorted. That's not the case. The odds are stacked against people. So, if you think about from a health eating point of view, you can have a health eating campaign, but ultimately people are constantly bombarded with an onslaught of marketing for high fat, salt, sugar foods. There's price offers, there's the availability every time you go to fill up your car, etc., no matter where you go. So you have to kind of look at it in that context, that it's not fair to rely on people to have more willpower when the society that we live in is pushing us to have an unhealthy lifestyle. Yeah.
And when we're talking about that, I wanted to focus there a minute for what you mean by system level change.
So that's really looking at the policies, be that, we've great examples like the workplace smoking ban and the sugar sweetened drinks tax. So those kind of population level policies that we all benefit from. It doesn't matter where in the country you live or, what your gender is or where ethnic background is. All public health benefits from those policies, but that change is hard. It requires a lot of political will to get them over the line. But it's really about changing, not the health system in terms of hospitals and healthcare sites. It's much broader. It's about society, really, and the world that we live in, and changing that system to make the healthier choice the easier choice for people.
Yeah. And we talked a lot about the social determinants of health, but looking at commercial determinants of health for a moment, and specifically you mentioned there about the food environment, there appears to be a collective recognition now that that needs to change. I mean, I've spoken about this a number of times actually on different episodes, but it does seem to come back to the food environment and just the need to change that.
Yes, it very much does. But I think the tactics that we're seeing in the food environment are very much from the tobacco playbook. So there's a commonality, whether you're talking about tobacco or alcohol or the food environment. We're seeing kind of similar tactics from corporate vested interests to influence health policy. So that's one of the reasons that the Irish Heart Foundation established a coalition of organisations called Health Promotion Alliance Ireland in recent months to collectively come together to push the prevention agenda, and that kind of commercial determinants of health and the corporate influence on health policy is a big part of our focus as well. It's really that dynamic of the power that corporate entities have versus individuals. And as I say, the odds being stacked against people. So how do our health policies get made? What is public health the primary objective here, or is it another objective?
Yeah. And who's on that group?
So it's a wide range of organisations, from chronic disease charities like the Irish Cancer Society, the Asthma Society, but also health and medical professional bodies and universities as well. So it's really just being established at the moment.
And what policy changes are needed to improve the cardiovascular health, do you think, of the population?
So we would talk about kind of 3 areas. Unfortunately, we're operating in a policy vacuum at the moment because there is no cardiovascular health policy. So that's something that we've in the foundation have been calling for, because we need that kind of framework to drive things across the country and to have that kind of collective effort across all stakeholders to really push the prevention and care agenda in cardiovascular disease.
Yeah.
And then secondly, we would need to look at the services for patients. So in the past, we would have called out that patients have been essentially abandoned at the hospital gates when they're discharged back to the community. And oftentimes a diagnosis of heart disease or having had a stroke, it has a huge impact on people, and not just physically, but also emotionally as well, and on their wider family. And that's a really important part of the Irish Heart Foundation services, is to support people, not just with medical information around treatment and management, but also we've initiatives like a choir, like art therapy, counselling, to support people to come to terms with their diagnosis and how to manage that with their families into the future. The third area is very much that prevention and policy, change. We would love to see, an expansion of the sugar sweetened drinks tax into other food category areas, looking at more initiatives to address air quality. That's really come on the agenda, that we often think that air quality affects people with asthma, but actually it's a huge determinant of stroke. So like there's research out of the Mater Hospital has shown that when the air quality is poorer in North City Dublin, that actually there's more referrals into stroke services. So that's really come up the agenda as well. And that's why when we talk about health, we can't not talk about the climate as well and climate emergency. And there are so many co-benefits of policies to address climate change that also will benefit heart health as well. So be it active travel, be it more sustainable diets, be it addressing air pollution, there's benefits for people and planet.
Yeah, very good. And I suppose finally, as we're nearing the end of this episode, I just wanted to ask you about the future and what you'd like to see change or continue, for that matter, in terms of heart health.
So we really see that we'll be continuing to build on our focused work in defending, empowering and caring for Irish hearts. So focusing on eliminating preventable disease. And as I say, there's much more to do there, but also importantly, caring and supporting for those who have been diagnosed with these conditions.
Okay, that's great. I would like to thank Janis Morrissey from the Irish Heart Foundation for joining me today. To all our listeners, thank you for your continued support, and please share this episode. If you'd like more information about HSE Health and Wellbeing, follow us on Twitter, take a look at our HSE Health and Wellbeing YouTube channel, or register for our Ezine by emailing healthandwellbeing.communications@hse.ie. This has been the HSE Talking Health and Wellbeing podcast. Thank you for listening.